A recent press release from the University of Otago's Preventive and Social Medicine Department highlighted key points from a commissioned report which details the significant impact of heavy drinking and intoxication on health outcomes in this country. Research suggests that alcohol is responsible for more than 1 in 20 deaths of kiwis aged under 80, and that breast cancer is the leading cause of alcohol-attributable death in New Zealand women. One of the authors of the report is Professor Jennie Connor, and she spoke earlier via Skype with Allan Lee.
Well, Professor Connor, thank you very much indeed for joining us on the programme today.
Well, thank you for inviting me.
We already knew so much about the harm that drinking can cause, that alcohol causes physiologically, but your research has taken it a step further, hasn't it?
Well, what we've tried to do with this project is bring all the information together. So there is a lot of understanding of the way the different properties of alcohol affect people's health. But you really need to get all of those pieces of information about different diseases and injuries and disabilities and so on together to get a sense of how big an issue it is for the health of the population. Because that's obviously, directly related to what we might decide to do about it.
So what sort of diseases are we talking about that are particularly impacted by alcohol?
Well, the one that usually comes to mind, first of all, is injury. And in fact, there's a whole range of harms that are related to intoxication. Injury includes not just traffic crashes and falling off high buildings and so on, but also intentional injuries, so violence and self-harm as well. So that makes up about 43% of all the deaths from alcohol in New Zealand, a little under half. And then of the rest, there's about 30% of the total is deaths due to cancer. And the cancer deaths include some of the commonest causes of cancer death in New Zealand, which are bowel cancer and breast cancer. So that's pretty important to us. And the final group, the 27% or quarter that's left, are other chronic diseases. So when we think about alcohol and chronic disease, we usually think about liver disease and some kinds of heart disease and so on.
Because the sad fact is that I guess alcohol is a toxin, isn't it?
Well, alcohol has some interesting properties, and apart from being an intoxicant, which is why people drink it, there's got to be a reason, and it's because it's psychoactive. It makes you feel different. Apart from that, it is directly toxic, for example, to your liver, and it's neurotoxic. So it affects the brain and nervous system, and you see that in unborn babies that have been exposed to alcohol have brain conditions, fetal alcohol spectrum disorder, for example. And you see it in binge drinking adolescents who damage their brains before they're fully formed or fully matured, and also in chronic heavy drinkers who have all sorts of nervous system damage. Alcohol's a carcinogen, so it causes cancer. And with most cancers, there's a whole lot of contributing elements, and alcohol's one of them. We can measure how much alcohol increases your risk of cancer, and therefore how many cancers are attributable to alcohol. On top of all of those things, of course, alcohol is addictive. And so for people who are addicted, that drives their consumption, and their consumption drives the health problems.
If you only drink so many units a day or a week, is that like a safety area? Can you drink safely?
I think safety is an interesting concept. It's not something we think about very much, but safety is relative, and so the obvious answer is yes. Many people do. Many people enjoy alcohol, don't suffer any untoward consequences. If you drink at all, you increase your risk of things going wrong. But if you drink in a fairly low risk way, a few drinks at a time, you're likely not to be too badly affected by it. There aren't really any thresholds though. So when we set a drink driving limit for alcohol, a lot of the population perceive that that is a safe limit, that you're safe if you don't have more than 0.08 level of alcohol in your blood. But that's not true. So it's not safe. It's not safe. It's never safer to drive with alcohol on board, and it's not safe even at 0.05. It just means that the risk, the increase in risk has been deemed acceptable to society. So as an extension of that idea of what risk is acceptable, drinking guidelines are starting to be developed that relate the recommended maximum amount that you should drink to what risk that translates into. And our new guidelines build on the Australian ones, which set out to identify what level of drinking is associated with a 1 in 100 risk of dying of your drinking. So a 1% risk, lifetime risk of dying from drinking. And working backwards, they came up with some guidelines of not having more than an average of 2 drinks a day and not having more than 4 drinks at one time and so on. And we've largely adopted that approach as well. But so there are drinking guidelines, but they don't guarantee that you'll be safe.
So it's not necessarily if you drink that, you're okay. You're just taking your risk down to only 1 in 100, which doesn't actually sound like a very good bet to me.
It sounds like a lot, doesn't it?
Yeah.
We say it like that. There are probably, I don't have them off the top of my head, but there are comparisons you can make with other activities that we undertake. I think most people are aware that some things we do are just inherently quite dangerous. And so people do accept risks of different kinds, and there's a lot of enjoyment that comes from drinking alcohol. And I think people would still drink if they understood the risks, but they would drink at a lower level than they do now. If everybody drank at the maximum drinking guideline, that would be a bad thing, because there are many New Zealanders who don't drink nearly that much. But if everyone stayed under the maximum drinking guideline, we would save a couple of $1 billion a year as a start, and that would be great. The alcohol situation in New Zealand is incredibly expensive, because it's not just we think of hospitals and health services. If you think of all the people who don't get access to service because the hospitals are full of people with alcohol-related problems, the prisons are full of people with alcohol-related problems. The courts see an enormous amount of crime that's directly related to alcohol, and so on and so forth. It just permeates everything. The police are busier by at least a third than they would be, and the ambulances and everything else. So there's a huge social cost.
As far as the government is concerned, so does your research give them some clues as to a way forward, and do you think they're paying attention?
What the research provides for the government is a better estimate than we've had before of the overall health burden of alcohol. Having said that, there are a lot of things missing from this. So whether you want to call it a health problem or a social problem when when domestic violence results from alcohol, that people want to give it different labels. But the situations in amongst the families of heavy drinkers and all the other members of the public who are affected by heavy drinkers who aren't heavy drinkers themselves, all of that kind of effect on society is not captured in studies like this. So this is a partial study. It's very heavily focused on physical health. But nevertheless, it says to the government, we have a significant issue here. There's 800 premature deaths a year in New Zealand. And for every one of those deaths, there's disability and misery, dependence problems, and so on. This particular report doesn't move forward the question of what we should do about that, because that evidence is already available. there is plenty of international research evidence to use to build a healthy alcohol policy, which is a suite of measures. And that evidence was reviewed by the Law Commission when they were having their inquiry, and in fact the blueprint for healthy alcohol policy is in the Law Commission's report. So what is missing from this is it's not research, and it's not synthesis of the research in a New Zealand context. All of that work was done. What's missing is the political will to do it.
That's a challenge indeed. Professor Connor, thank you very much indeed for your time today.
Thank you.